Welcome. Now we are going to start lecture 2, Emerging Issues in Bioethics. The field of bioethics stands at the intersection of science, medicine, law and philosophy, offering critical guidance as we navigate the ethical implications of technological and medical advancements. As we move deeper into the 21st century, the rapid pace of innovation presents new ethical challenges that were unimaginable just a few decades ago. Genetic testing and personalized medicine promise revolutionary improvements in healthcare, allowing for treatments tailored to the individual at molecular level. However, these advancements also raise pressing ethical concern regarding privacy, informed consent, and the potential for genetic discrimination. Similarly, the issues surrounding end-of-life care and euthanasia force society to grapple with fundamental questions about the value of life, autonomy, and right to die with dignity. Organ transplantation, a life-saving medical procedure, is fraught with its own ethical dilemmas, including the equitable allocation of scarce resources and the ethical implications of living versus deceased donation. As these technologies and practices continue to evolve, so too must our ethical framework. This lecture aims to develop into emerging issues to bioethics using real-world case studies and ethical dilemmas to explore their profound impact on patients, healthcare providers, and society at large. By examining these issues through a bioethical lens, we can better understand the balance between scientific progress and moral responsibility, ensuring that advancements in medicine and technology serve the greater good without compromising ethical principles. Genetic testing and personalized medicine. Genetic testing and personalized medicine represent the forefront of modern healthcare, offering the potential to revolutionize how we diagnose, treat, and prevent diseases. Genetic testing involves analyzing an individual's DNA to identify genetic variations that may predispose them to certain health conditions or affect how they respond to medications. This information enables personalized medicine, where treatments are tailored to unique genetic makeup, lifestyle, and environment of each patient. While these advancements promise more effective and targeted therapies, they also raise significant ethical concerns, including issues of privacy, informed consent, and equitable access to these cutting-edge technologies. As these fields evolve, it is crucial to address these ethical changes to ensure that the benefit of genetic testing and personalized medicine are realized in a responsible and inclusive manner. What are the benefits of genetic testing? The benefits of genetic testing are profound, offering individuals and healthcare providers valuable insights that can significantly improve health outcomes. By identifying genetic predispositions to various diseases, genetic testing enables early detection and preventive measures, potentially reducing the severity or even preventing the onset of certain conditions. It also plays a crucial role in guiding personalized treatment plans, allowing for the selection of therapies that are most likely to be effective based on a patient's genetic profile, thereby minimizing adverse reactions and improving the efficacy of treatments. Furthermore, genetic testing can provide important information for family planning, helping individuals understanding their risk of passing or genetic disorders to their children. Overall, genetic testing empowers patients with knowledge that can lead to more informed healthcare decisions and a proactive approach to managing their health. We will start with a case. Genetic testing for cancer risk. Jane Doe, a 38-year-old woman with a family history of breast and ovarian cancer, is referred to a genetic counselor after her mother is diagnosed with ovarian cancer at the age of 60. Concerned about her own risk, Jane decides to undergo genetic testing to determine whether she carries any hereditary mutations that may increase her risk of developing cancer. The genetic test focuses on analyzing Jane's BRCA1 and BRCA2 genes, which are known to significantly increase the risk of breast and ovarian cancer when mutated. These genes normally produce protein that help repair damaged DNA, but mutation can lead to failure in DNA repair mechanism, thereby increasing the likelihood of cancer development. Test results. Jane's result revealed that she carries a pathogenic BRCA1 mutation, which means she has a higher lifetime risk of developing breast cancer and ovarian cancer. This information is life-changing as it confirms her heightened risk and allows her to consider various preventive and monitoring options. Ethical consideration. Before undergoing the test, Jane was informed about potential outcomes and implications of knowing her genetic status, including the emotional impact and decisions she might face. Privacy and confidentiality. Jane's genetic information is sensitive and there are concerns about who should have access to her results. Ensuring that her information remains confidential is a paramount to preventing misuse or discrimination. Family implications. Jane's result have implications not only for her but also for her family members who may also be at risk. Ethical dilemmas arises regarding whether and how to inform relatives who might benefit from knowing their genetic risk. Decision making. Armed with this knowledge, Jane faces difficult decisions. She may opt for increased surveillance, for example, regular mammograms and MRI scans, chemo prevention, or even prophylactic surgery, such as mastectomy or oophorectomy to reduce her risk. Each option comes with its own risk and benefits, requiring careful consideration and discussion with her healthcare providers. Impact on Jane's life. The genetic test results lead to Jane to make a proactive decisions about her health. After consulting with her doctors and weighing the options, Jane decides to undergo a preventive double mastectomy to significantly reduce her risk of breast cancer. She also decides to increase her monitoring for ovarian cancer and plans to discuss future options such as oophorectomy after completing her family. Conclusion. Jane's case illustrates the power of genetic testing in personalizing healthcare and empowering individuals to make informed decisions about their health. However, it also highlights the complex ethical, emotional, and family considerations that accompany genetic testing. The ability to predict cancer risk through genetic testing is a double-edged sword, providing potentially life-saving information while also burdening individuals with challenging decisions and the need for careful consideration of the broader implications for themselves and their loved ones. Ethical concerns in genetic testing. Ethical concerns in genetic testing include ensuring informed consent, protecting genetic information from misuse, and preventing genetic discrimination. Patient must be fully informed about potential outcomes and implications of genetic testing. Informed consent involves a comprehensive discussion of the benefits, risks, and limitations of the test. Additionally, genetic counselors play a crucial role in helping patients understand their results and the possible impact on their lives and families. Genetic testing, while offering significant benefits in personalized medicine and disease prevention, also raises several ethical concerns that requires careful consideration. First is privacy and confidentiality. One of the primary ethical concerns is the protection of an individual's genetic information. Genetic data is highly sensitive and can reveal much more about person's health, ancestry and potential future medical conditions. There is a risk that this information could be accessed or used without consent, leading to breaches of privacy. Ensuring that genetic information remain confidential and secure is essential to prevent misuse, such as unauthorized sharing with employers, insurers, or other third parties. Informed consent. Another critical ethical issue is the process of obtaining informed consent before conducting genetic test. Patient must fully understand the implications of genetic testing, including the possible outcomes, psychological impacts, and the broader consequences for family who may also be at risk. There is a responsibility to ensure that individuals are not coerced into testing and that they make decisions based on clear understanding of the risk and benefits. Genetic discrimination. The potential for genetic discrimination is a significant concern, particularly in the context of employment and insurance. There is a fear that individuals with a certain genetic predispositions could face discrimination, such as higher insurance premiums or denial of coverage based on their genetic information. This raises questions about fairness and the need for legal protection to prevent such discrimination. Impact on family members. Genetic testing often has implications beyond the individuals being tested, as it can reveal information about the genetic risk of family members. This can lead to ethical dilemmas about whether and how to share this information with relatives who might be affected. The responsibility to inform family members must be balanced with the individual's right to privacy and the potential emotional burden that such information can impose. Psychological impact. The knowledge gained from genetic testing can have profound psychological effect on individuals. Learning about increased risk for serious disease such as cancer can lead to anxiety, stress, or sense of fatalism. On the other hand, uncertainty in test results can also cause distress. Providing adequate psychological support and counseling is crucial to help individuals cope with emotional impact of their genetic information. Equity and access. There are concerns about equitable access to genetic testing and associated medical care. Not everyone has the same access to these advanced technologies, which can exacerbate existing healthcare disparities. Ensuring that genetic testing is accessible to all, regardless of socioeconomic status, is an important ethical consideration to avoid creating a divide between those who can benefit from these advancements and those who cannot. Moral responsibility. The ability to predict future health risk raises ethical questions about what action should be taken based on this knowledge. For example, if a genetic test reveals a high risk of serious disease, is there a moral obligation to take preventive measures? Additionally, how should healthcare providers balance their duty to inform patients about potential risk with respect for the patient's autonomy in making their own healthcare decisions? In summary, while genetic testing offers the promise of personalized healthcare, it also necessitates careful consideration of ethical issues related to privacy, consent, discrimination, familial responsibilities, psychological impact, and equitable access. Addressing these concerns is crucial to ensuring that genetic testing is conducted in a manner that respects individual rights and promotes fairness and social justice. Privacy in genetic testing. Privacy in genetic testing is a critical concern as it involves sensitive personal information that can reveal a wealth of data about an individual's health, ancestry, and predisposition to various genetic conditions. The genetic data obtained from testing can expose not only the individual's health risk but also the potential health risk for their family members, raising significant issues about confidentiality and the potential for misuse. Ensuring privacy requires robust safeguards, including secure data storage, strict access controls, and clear consent processes. Patients must be informed about how their genetic information will be used, shared, and protected. Regulatory frameworks such as Genetic Information Non-Discrimination Act in the United States provides some protection against genetic discrimination, but challenges remain, especially with the rise of direct-to-consumer genetic tests and potential data breaches. It is essential for both healthcare providers and genetic testing companies to uphold high standards of data protection to maintain trust and prevent unauthorized access to misuse of genetic information. Case example: imagine Jane, a 35-year-old woman who decides to undergo genetic testing through a direct-to-consumer testing company to explore her ancestry and potential health risk. The result revealed not only her predisposition to certain genetic conditions but also unexpected information about her family, including the potential health risk of her siblings and even distant relatives. Jane is initially excited about the insights but becomes concerned when she receives a promotional email from a company that obtained her genetic data from the testing service. The email offers health-related products and services based on her genetic profile. Jane is alarmed, realizing that her sensitive genetic information, which she believed was confidential, has been shared without her explicit consent. Further investigation reveals that the testing company had included a broad consent clause in their terms of services, allowing them to share data with the third parties for marketing purposes. Jane's case highlights several key privacy concerns. What will be these concerns are? Informed consent. The broad consent terms might not have clearly communicated how Jane's data could be used or shared, leading to an unintended exposure of sensitive information. Data security. The sharing of data with third parties raises questions about how well the testing company secures and monitors the use of genetic information. Potential misuse. The data's availability to marketing companies could lead to unwanted solicitations and potential exploitations of Jane's health information. In response to her concerns, Jane decides to contact the testing company and request that her data be deleted. This scenario underscores the importance of transparent privacy practices, informed consent, and stringent data protection measures in genetic testing. Genetic discrimination occurs when individuals are treated unfairly based on their genetic information or predisposition to certain health conditions. This form of discrimination can manifest in various areas, including employment, insurance, and social interactions. For example, an employer might refuse to hire or promote an individual based on their genetic risk for certain diseases, or an insurance company might deny coverage or increase premiums based on genetic test results. The rise of genetic testing technologies has increased the availability of personal genetic data, amplifying concerns about privacy and potential misuse. Genetic discrimination can have profound implications for individuals, including emotional distress, financial hardship, and social stigma. It also poses significant ethical and legal challenges as it intersects with issues of privacy, autonomy, and fairness. Efforts to combat genetic discrimination, including legislative measures such as the Genetic Information Non-Discrimination Act in the United States, which provides some protection against discrimination by employers and health insurers. Understanding and addressing genetic discrimination is crucial for ensuring that advancements in genetic science benefit individuals without compromising their rights or dignity. Now you will see another case. Ravi, A 40-year-old IT professional in India decides to undergo genetic testing after learning that he has family history of hereditary condition. These results reveal that he had genetic predisposition to a serious cardiovascular disease. Concerned about his health, Ravi applies for a health insurance policy to ensure he is financially protected in case he develops the condition. To his dismay, Ravi's insurance application is denied and he is informed that the decision was based on his genetic risk profile. The insurance company cites his genetic predisposition as a risk for the denial, arguing that his risk of developing a significant health issue is higher than the average policy holders. This situation highlights several key issues related genetic discrimination in insurance. Lack of regulatory protection. Unlike some countries, India does not have comprehensive laws specifically addressing genetic discrimination in insurance. This gap leaves individuals like Ravi vulnerable to unfair treatment based on their genetic information. Ethical concerns. Using genetic information to deny insurance coverage raises ethical questions about fairness and the right to access essential services. It creates a barrier for individuals seeking protection and potentially exacerbate their health inequities. Privacy and consent. Ravi's experience underscores the need for stringent regulations on how genetic information is used by insurance companies. Ensuring that individuals' genetic data is used responsibly with proper consent is critical to protecting privacy. Advocacy and awareness. The case highlights the need for increased advocacy and awareness about genetic discrimination. Public and government pressure may be necessary to develop and enforce policies that protect individuals from genetic discrimination in insurance and other sectors. In response to Ravi's situation, consumer advocacy groups and legal experts in India are pushing for stronger regulations and protection to prevent genetic discrimination and ensure that the advancement in genetic science benefit everyone equally. Personalized medicine. Personalized medicine, also known as precision medicine, is a medical approach that tailors treatment and healthcare decisions to the individual characteristics of each patient. Unlike the traditional one-size-fits-all model, personalized medicine takes into account a person's genetic makeup, lifestyle, environment, and other factors to design more effective and targeted therapies. At the core of personalized medicine is the use of genetic information to guide decisions about the prevention, diagnosis, and treatment of diseases. By undergoing the unique genetic profile of a patient, healthcare providers can predict how they might respond to specific medication, identify the most suitable treatment options, and even anticipate potential health risks before they manifest. Advancement in genetic testing, data analytics, and biotechnology have accelerated the development and implementation of personalized medicine. This approach has shown significant promise in fields such as oncology, where treatment can be tailored to genetic mutation, driving a patient's cancer, and in rare genetic disorders, where specific gene therapies can address the root cause of the disease. However, the rise of personalized medicine also brings challenges, including ethical considerations around genetic privacy, the potential for increased healthcare costs, and the need for robust regulatory frameworks to ensure equitable access to these advanced therapies. Overall, personalized medicine represents a shift toward more individualized and precise healthcare, aiming to improve patients' outcome by considering the unique aspect of each person's health. What are the benefits of personalized medicine? It will be targeted treatment. Personalized medicine enables healthcare providers to design treatments specifically tailored to a patient's genetic profile and unique characteristics. This increases the likelihood of effectiveness and reduces the chances of adverse reaction. For example, in cancer treatment, therapies can be chosen based on the genetic mutations. specific to patient's tumor, improving outcome and minimizing unnecessary side effects. Prevention and early detection. By understanding an individual's genetic predispositions, personalized medicine allows for proactive healthcare strategies. Patients at high risk for certain diseases can undergo more frequent screenings or adopt lifestyle changes that may prevent the onset of illness. Early detection through personalized monitoring can significantly improve prognosis, particularly for conditions like cancer and heart disease. It will also minimize side effects. Traditional treatments often come with a risk of side effects that may not affect everyone equally. Personalized medicine reduces this risk by selecting therapies that are more compatible with the patient's biology. For instance, genetic testing can identify patients with maybe more prone to adverse reactions to certain drugs, allowing doctors to choose safe alternatives. Improved patient outcomes. By customizing healthcare, personalized medicine enhances the overall effectiveness of treatment. Patients receive therapies that are more likely to succeed, leading to better health outcomes, faster recovery times, and a higher quality of life. This approach is particularly beneficial in managing chronic diseases where ongoing tailored interventions are crucial. Benefits for personalized medicines. Cost effectiveness. Although personalized medicines can involve advanced technologies and genetic testing, it can also lead to long-term cost savings. By selecting the most effective treatment from the start, it reduces the need for trial and error prescribing, hospitalizations due to adverse effects, and unnecessary procedures. In the long run, personalized medicine can lower healthcare costs by preventing diseases and optimizing treatment strategies. Patients' empowerment. Personalized medicine often involves patients more actively in their healthcare decisions. By providing individuals with informations about their genetic risk and the best treatment options, it empowers them to make informed choices about their health. This increased involvement can lead to greater patient satisfaction and adherence to treatment plans. Advancement in medical research. The personalized approach contributes to the development of new therapies and drugs tailored to specific genetic profiles. As more data is collected and analyzed, it enhances our understanding of the complex interplay between genetics and disease, leading to innovative treatments and potentially cures for conditions that were previously difficult to manage. Personalized medicine raises ethical questions about equitable access, the cost of genetic testing, and the potential for exacerbating health disparities. High cost of genetic testing and personalized treatments may limit access for disadvantaged populations, leading to inequities in healthcare outcomes. Ensuring that personalized medicine is accessible to all patients regardless of socioeconomic status is crucial for ethical practice. Example, a new personalized cancer therapy is highly effective but very expensive. This raises ethical concerns about access and fairness, particularly for patients from low-income background who may not be able to afford the treatment. This scenario underscores the need for policies that ensure equitable access to advanced medical treatment. Ethical issues in personalized medicine. Genetic privacy and confidentiality. One of the primary ethical concerns in personalized medicine is the protection of genetic information. Genetic data is highly sensitive as it can reveal not only a patient's health risk but also information about their family members. The potential for data breaches or misuse of genetic information by employers, insurers, or other entities raises significant privacy concerns. Ensuring that patients' genetic data is securely stored and only used with informed consent is crucial to maintaining trust in personalized medicine. Informed consent. The complexity of genetic information and its implications make informed consent a challenging issue in personalized medicine. Patient must fully understand what their genetic testing entails, how their data will be used, the potential risk and the long-term implications for themselves and their families. However, given the technical nature of genetics, there is a risk that patients may not fully comprehend this information, leading to consent that is not truly informed. Access and equity. Personalized medicine often involves advanced technologies and treatments that can be expensive, raising concern about equitable access. There is a risk that these innovations may not only be available to those who can afford them, exacerbating existing healthcare disparities. Ensuring that personalized medicine benefits all segments of the population, regardless of socioeconomic status, is an ongoing ethical challenge. Ethical issues in personalized medicine. Genetic discrimination. The potential for genetic discrimination is another significant ethical issues. Employers, insurers, and other institutions may misuse genetic information to make decisions about individuals, such as denying employment or insurance coverage based on genetic predispositions. While laws like Genetic Information Non-Discrimination Act in the US offer some protection, concerns remain about the adequacy and enforcement of such regulation. Impact on family members. Genetic testing can reveal information that has implications not just for the individual being tested, but also for their biological relatives. For instance, a patient who discovers they have a genetic predisposition to a particular disease may also inadvertently reveal that their family members are at risk. This raises ethical questions about the right to know and the right not to know, as well as the responsibility to inform family members of potential health risk. There is also a psychological impact. Learning about one's genetic risk can have a profound psychological impact. While some individuals may find it empowering to know their genetic predisposition, others may experience anxiety, stress, or a sense of fatalism. There is an ethical responsibility to provide adequate counseling and support to help patients understand and cope with their genetic information. Potential for over-medicalization. Personalized medicine could lead to over-medicalization, where individuals are subjected to unnecessary treatments or intervention based on genetic risk that may never manifest into actual diseases. This raises ethical concerns about the potential harm of overtreatment, as well as the influence of commercial interest in promoting unnecessary medical services. Regulatory and ethical oversight. The rapid advancement of personalized medicine has outpaced the development of regulatory frameworks and ethical guidelines, ensuring that there is appropriate oversight to govern the use of genetic data, the development of new therapies, and the implementation of personalized medicine is crucial. This includes addressing conflicts of interest in research and ensuring that new treatments are both safe and effective before they are widely adopted. Now we'll start with a case study. Dr. Meera, an oncologist practicing in Mumbai, is treating Rajesh, a 52-year-old patient recently diagnosed with advanced non-small cell lung cancer. Traditionally, NSCLC is treated with a standard regimen of chemotherapy and radiation. However, these treatments often come with a significant side effects and variable effectiveness. Given the growing field of personalized medicine, Dr. Meera decides to take a more individualized approach to Rajesh treatments. Genomic testing. Dr. Meera recommends that Rajesh undergo genomic testing to identify specific mutation in his cancer cells that might be driving the disease. This approach is gaining traction in India, particularly in urban centers, as more hospitals and diagnostic labs offer genomic profiling services. Rajesh's family is initially hesitant due to cost of the test, which is not fully covered by insurance. However, after counseling on the potential benefits, they agree. The genomic testing reveals that Rajesh's tumor has a mutation in EGFR that is epidermal growth factor receptor gene, which is known to respond well to targeted therapy. Dr. Meera explains that instead of conventional chemotherapy, Rajesh can be treated with EGFR inhibitor, a targeted drug designed to block the effect of the mutation, potentially leading to better outcomes with fewer side effects. Treatment and outcome. Rajesh begins the targeted therapy and experiences a significant reduction in tumor size within a few months, with minimal side effects compared to traditional chemotherapy. The personalized approach not only improves Rajesh's quality of life but also extends his progression-free survival, giving him more time with his family. Challenges and ethical consideration. While Rajesh's case demonstrates the potential benefits of personalized medicine in oncology, it also highlights several challenges specific to the Indian context. Cost and accessibility. The high cost of genomic testing and targeted therapies is a significant barrier in India, where healthcare costs are often out-of-pocket expenses for patients. Although personalized medicine is more accessible in metropolitan areas, there is a stark disparity in rural regions where advanced diagnostic services are scarce. This raises ethical concerns about equitable access to cutting-edge treatments. In Rajesh's case, the cost of genomic testing and targeted chemotherapy was only partially covered by insurance, leading to financial strain on his family. In India, most health insurance policies have limited coverage for genetic testing and personalized therapies, which restrict the widespread adoption of personalized medicine. The successful implementation of personalized medicine requires robust infrastructure, including advanced diagnostic labs and skilled personnel to interpret genetic data. While cities like Mumbai, Delhi, and Bangalore are developing this capacity, much of the country still lacks the necessary resources, limiting the reach of the personalized oncology treatments. There are some ethical issues. Personalized medicine in oncology also brings ethical challenges such as psychological impact of genetic information on patients and their families. In Rajesh's case, the knowledge of the genetic mutation could have caused significant anxiety, and there were concerns about how this information might affect his family member who might also carry the same genetic predisposition. Conclusion. Rajesh's case underscores the transformative potential of personalized medicine in oncology, particularly in improving patient outcomes and quality of life. However, it also highlights the need for broader access to these advanced therapies across India. To fully realize the benefits of personalized medicine, there must be effort to reduce cost, expand insurance coverage, and improve healthcare infrastructure, ensuring that all patients, regardless of their location or financial status, can access personalized treatments. Now we will start with the end